Hi, it's that anxiety check again, and I want to talk about trauma really today. Actually, this is my second video today, so basically, trauma is very much a complicating factor, and it has to be considered in relation to anxiety and panic attacks and everything that's all those experiences that you go through in life and you endure, and it can be a complicating factor. I don't think it can be denied that anxiety isn't always straightforward. Panic attacks and everything else that you experience can be made worse by things that you might have gone through in the past. And so, the reason why I wanted to talk about this is because there are many people that have been through all sorts of different things in their lives, and it could be you. It could be that you've been through a lot of trauma when you were a child, or you've had a lot of experiences that have traumatized you, and it could be a whole variety of things. As I said before many times, we're all unique, so what might be complicating your anxiety could be different to somebody else's, but nevertheless, it is making you feel sometimes perhaps helpless when you are experiencing anxiety or a panic attack. So I think one of the main things with trauma is the need to try and feel safe. And obviously, when you are undergoing perhaps exposure therapy through perhaps trying to overcome something like anxiety, agoraphobia, that kind of thing. I'm sorry, I'm being slightly distracted by my dog again, who is wandering around as usual and won't settle down. But basically, with something like, for example, if you are trying to overcome agoraphobia and yet you've been through an awful lot of trauma, it can be very difficult because one of the main therapies that are used when people have experienced trauma and they may be suffering from complex trauma or CPTSD, then that means that often trauma processing can be involved in the therapy to try and help you come to terms with what happened to you before. In addition to that, it can be hard sometimes to be able to accept and to float and go with feelings that you are experiencing with anxiety. It's a question of being able to separate really what you've gone through before and being able to then use techniques such as exposure therapy, CBT, in which to overcome the anxiety that you are experiencing. It can be hard when you suffer from emotional flashbacks, from things that have happened before, and they can come out of the blue and you don't really know what's caused it. And you are faced with really a double whammy in a way, because you're trying to cope with all the trauma that you've been through, and you're trying to deal with anxiety symptoms, sensations, and the way that have become sensitized. It's almost like you're hypervigilant. But it all is obviously not lost. You never must give up hope, because it is possible to overcome what you have been through in the past by coming to terms with that. But like I said, that can be hard. And occasionally having the extra support may be what is required. Somebody who is experienced with people who have been through trauma. So I do think it's important to be able to separate what you have experienced before and how that is having an impact on your anxiety today. But even so, still the techniques of accepting and floating, not adding the second fear, which is obviously what Claire Weekes has said about in her books, which are really, really important, and I would always suggest that you read those books. And CBT in itself also, it is about trying to gradually, in most cases, expose yourself to what you really fear. But there are some things that are still trapped in your past that you still fear. And that is a complicating feature of anxiety, which is why we aren't all the same. So what I would recommend that you do is use a lot of compassionate self-care to recognize the fact that there is still nurturing that's needed to be done to your inner self, and to also be able to explore those feelings, to try and find ways and means of feeling safe. But at the same time, when you feel ready, to also to be able to go out there and to practice techniques such as floating and relaxing when you are experiencing a panic attack. All of these things all help, but they sometimes need to be combined, and it can be a difficult road. It's not an easy thing to do, especially if you are still, in some ways, still in an environment where you're still being traumatized. But the most important thing is to realize that just through accepting the fact that these things have happened to you and have made you a stronger person as a result, so that has to be true because you are here now watching this, and that you can still overcome your anxiety despite all that you have been through. That is the most important thing of all. Keep practicing not adding a second fear when you do experience anxiety, despite what the source of that anxiety is. Keep on trying to float with the sea, the tide, and still be like a rag doll. Recognize that there are things that have happened that have complicated the anxiety for you, but never ever give up hope, because there is light at the end of the tunnel. I am an example of that. I am here now despite everything that I have been through, and I hope that together we can find a way to really find that light at the end of the tunnel, because it really does exist. And I hope that's helped a little bit today. This is That Anxiety Chick, and signing out again. Thank you.